think our medical providers have been the real heroes of this pandemic. At the beginning, there was so much fear. We didn't know how rapidly the virus would transmit, how symptomatic people would become, what the death rates would be like. Put yourself in the shoes of one of our healthcare providers. You walk into work, you put on all your protective garb, which makes you feel a little scared from the start, and then you walk up to a car with a patient you know has COVID. And then you do that 20 times during the day. And then you walk home and you go and see your husband, your kids, maybe your parents, and imagine how that feels, and the fear and the unknown, and yet the desire to serve. We healthcare providers are trained to be supportive of our patients. That's who we love. That's why we're here. I think the work of 16th Street and other community health centers in Milwaukee during the COVID pandemic has really showcased what is a community health center. We serve the folks that are most vulnerable, and so community health centers really stood up to respond quickly to the needs of those health disparities that were becoming evident very early in the pandemic. In our role as healthcare providers, we see some of the social needs that patients are experiencing as they're going through this pandemic. Patients are very scared, rightly so, not only about getting sick, but also getting their families sick or being able to continue to work. Many of the folks we serve are essential workers and work in jobs where they continued to leave their homes every day to go to work because the work was essential and because the paycheck for the family was essential. It is a challenge to educate folks on how important it is to isolate. If you have symptoms, you can't go to work because you may transmit it to others. But what if that means they can't receive a paycheck and provide food for their families? That education is difficult because we can see the choices that families are having to make, and those are really difficult choices. That comes with it a whole set of responses for the healthcare provider. Sadness, frustration, wanting to help, but can't do everything. We're all in this together, and there's so many ways that we've seen that as the pandemic has played out. We do our best to provide services no matter a patient's ability to pay. And we're part of a network of clinics across the community that rely on grants and donations to meet that need. One of the ways is through the support that we've received from the United Way, from the Milwaukee Healthcare Partnership. The Milwaukee Healthcare Partnership has been a vital leader in having a bird's eye view of healthcare in Milwaukee. Not only the health systems, but the community health centers, the free clinics. The partnership is able to see all of us and see all of our roles and where we each fit. They can also see the gaps and work to fill those gaps. So the safety net and the system in general are all collaborating and all working together. Together, the United Way and the Milwaukee Healthcare Partnership through the Health Improvement Fund provide critical support to 16th Street and other clinics that make up the safety net. Donations to the Health Improvement Fund help nonprofit clinics across the community provide critical health services to the most vulnerable of our community. I'm so proud of our staff, both our medical assistants, our nurse practitioners, physician assistants, physicians, for the work that they've done in putting themselves out there, putting themselves on the line. One of our providers said, "This is the community that is essential workers. They've been going out and working for us. Now it's our time to give back to them."